Many people believe they've planned well for retirement. They've saved, they've paid off debt, they've thought about income. But there's one factor that quietly undermines more retirement plans than almost anything else: health care. Not just emergencies, not just major illness, but the slow, steady, unavoidable cost of staying healthy over time. Healthcare is one of the biggest reasons retirement plans fail quietly instead of suddenly. There's no dramatic moment, no single mistake. Just pressure that builds year after year. Over 15 years of working with retirees, I've watched healthcare costs dismantle carefully built retirement plans more often than market crashes or poor investment choices. Not because people were irresponsible, not because they ignored the issue completely, but because they underestimated how relentless healthcare costs actually become over time. They planned for healthcare as if it were a fixed expense, as if the costs they saw at 65 would remain stable through their 70s and 80s. But healthcare in retirement doesn't work that way. It grows, it compounds, and it accelerates exactly when retirees are least able to absorb the increase. Most people underestimate healthcare costs because they think in terms of today, what they pay now, what insurance costs now, what prescriptions cost now. But retirement healthcare costs don't stay still. They grow, they shift, and they often accelerate later in life. This creates a problem many retirees don't see coming. In the early years of retirement, healthcare often feels manageable. You're still relatively healthy. You may not need frequent care. Expenses feel predictable. This creates a false sense of security. People assume that if they're fine now, they'll probably be fine later. But later is when healthcare becomes more expensive, more complicated, and less flexible. And that's when the pressure shows up. I've sat with people in their mid-70s who are suddenly facing healthcare costs they never anticipated. A new diagnosis that requires expensive medication. A chronic condition that needs ongoing management. A spouse who needs care that Medicare doesn't fully cover. These aren't catastrophic events. They're normal aging. But the financial impact is significant. And when these costs arrive, they don't come temporarily. They become permanent additions to the monthly budget. A prescription that costs $300 per month doesn't disappear. It continues, month after month, year after year. That permanence changes everything. Healthcare in retirement isn't just about doctor visits. It includes insurance premiums, out-of-pocket costs, prescription drugs, dental care, vision care, hearing care, and long-term support needs. Many of these costs increase faster than general inflation. And retirees feel this more deeply because they can't simply increase income to compensate. When you're working, a salary increase can absorb rising costs. In retirement, there's no equivalent adjustment. Your income is largely fixed, but your healthcare costs are not. That mismatch creates ongoing pressure. This is why healthcare costs feel heavier in retirement than at any other time. They arrive whether you plan for them or not. Let me give you a concrete example. Someone retires at 65, paying $400 per month for supplemental insurance. They budget for that amount carefully. By 70, that premium has increased to $550 per month. By 75, it's $700. By 80, it's closer to $900. That's more than double the original cost. And it's not because coverage improved, it's simply the reality of aging into higher risk categories. Now add prescription costs that have increased, add dental work that's needed more frequently, add hearing aids that weren't necessary before. Suddenly, what was budgeted as $6,000 per year for healthcare has become $15,000 per year. That's a $9,000 annual difference. Over 10 years, that's $90,000 in unexpected costs. For many retirees, that difference is the margin between feeling secure and feeling stressed. Another reason healthcare causes so much stress in retirement is unpredictability. You can plan for groceries, you can plan for utilities, You can even plan for travel, but healthcare rarely follows a neat plan. One year may be quiet, the next may not be. A new prescription, a new diagnosis, a change in coverage. Each change adds pressure. This unpredictability forces retirees to think defensively. They delay spending. They avoid enjoyment. They worry about what-if scenarios. Even retirees with solid savings begin to feel fragile. Because healthcare costs don't just affect money, they affect confidence. I've worked with couples who have $800,000 saved. On paper, they should feel comfortable. But because they've watched healthcare costs climb unpredictably year after year, they've lost confidence in their plan. They second-guess every expense. They avoid making decisions that would improve their quality of life. They live more conservatively than they need to. Not because the money isn't there, but because they've lost trust that it will be enough. That psychological damage is real. Another issue is that many people assume Medicare covers everything. It doesn't. Medicare helps, but it has gaps. Those gaps must be filled with savings, supplemental coverage, or ongoing out-of-pocket spending. And those costs don't disappear over time. They usually increase. Medicare Part B premiums increase with income. Supplemental plans increase with age. Prescription drug coverage has deductibles and copays that add up. This is why retirees who didn't plan specifically for healthcare often feel blindsided, not because they were careless, but because healthcare planning requires a different mindset. It's not about averages, it's about resilience. It's about having room in the plan for higher costs later. Another challenge is that healthcare expenses often rise at the same time flexibility decreases. Later in retirement, people have fewer options. Working becomes harder. Moving becomes harder. Adjusting lifestyle becomes harder. That combination makes healthcare costs feel overwhelming. This is why healthcare planning is really about timing, not just cost. A plan that works at 65 may feel strained at 85, and that gap matters. I've seen this pattern play out repeatedly. Someone retires with a plan that covers their expected expenses at 65. For the first 5 or 10 years, everything works. Then healthcare costs begin rising faster than anticipated. Suddenly, the budget that felt comfortable starts feeling tight. By their late 70s or early 80s, they're making difficult choices. Skipping recommended treatments, delaying necessary care, cutting back on quality of life to preserve savings. Those choices shouldn't be necessary, but they become necessary when healthcare wasn't properly factored into the long-term plan. So how do retirees protect themselves from healthcare becoming a breaking point? Not by predicting exact costs, that's impossible, but by building margin into the plan. Margin means flexibility. It means not assuming best-case scenarios. It means planning for rising costs instead of flat ones. It also means understanding how healthcare fits into the larger retirement picture. Healthcare costs don't exist in isolation. They interact with income. They interact with savings. They interact with stress. Retirees who feel secure usually do one thing differently. They treat healthcare as a long-term reality, not a short-term inconvenience. They assume costs will rise, they assume needs will change, and they build their plan accordingly. This mindset changes behavior. Instead of reacting to healthcare expenses with fear, they expect them. Instead of panicking when costs increase, they adjust calmly. That adjustment is what protects confidence, because retirement is not just about money lasting, it's about feeling safe using it. Healthcare planning isn't about pessimism, it's about realism. It's about acknowledging that health and aging are connected and that ignoring that connection creates risk. The retirees who navigate healthcare costs most successfully are those who planned for escalation from the beginning. They didn't assume costs would stay flat. They didn't hope for the best. They planned for reality. And that planning gave them the freedom to enjoy retirement without constant financial anxiety. In future videos, we'll break down how healthcare costs typically change over retirement, how retirees budget for medical expenses realistically, and how to build income plans that absorb rising costs without panic. No fear, no exaggeration, just clear thinking. Because retirement works best when the biggest risks are acknowledged early, not discovered late,